first part of the series was the new patient interview. The second part was the new patient comprehensive examination. Now we're going to talk about the new patient consultation. As I said, following the new patient examination, you want to be clear with the patient that anybody involved with the finances should be present at the consultation. One of my most dreaded things would be to have a consultation with someone and they say, I need to go home and talk with my spouse. Well, they don't have the books, they don't have the patient's photographs, they don't have the radiographs, they haven't had me explain it, and so it's probably not going to go anywhere if that happens unless that person makes all the decisions for themselves. If they've got to consult with someone, they should have been at the consultation. So this is the new patient consultation. Now, this is the same patient we've been talking about in the interview and the comprehensive examination. This part right here is what the patient told me. This is what I wrote down on that yellow piece of paper, what they told me. Sensitive teeth, I have interproximal decay, or my other dentist told me about interproximal decay, whatever. And the reason I write it down right here, I want the patient to know that I heard what they said. So I'm going to write down on that pad what they told me, and I'm going to print it there. This is examination results. Much calculus and plaque on the teeth, extensive decay in the teeth interproximally, occlusally, and facially. Moderate to severe decay is present between every tooth in your mouth. Much hypocalcification on the facial surfaces of the teeth. That's the white areas from something like Coca-Cola, sugar cough drops, whatever. And then the lower anterior fixed lingual bar is broken and half of it's missing. This is not the treatment. This is the examination results. Then this is the discussion if there's something to talk about. So let's go through this. I sent your radiographs and diagnostic photographs to your previous dentist in the town, so you and your parents could discuss your dental condition with him. I spoke with the dentist on the phone following your examination. I want to make it clear, I'm not trying to sell them anything. I don't care if I do the case or not. If I do it, we've got to do one that's as complicated the way I want to do it. If they don't want to do it that way, then I want to help any other dentist get it the way they want it. As this dentist knows, I treat cases like yours regularly, but the treatment's very complicated, involved, and expensive. Because of these issues, it's sometimes more practical to remove all the teeth and replace them with all-on-4, which is a fixed-in-place, implant-supported, non-removable prosthesis. Now think about that. Who wants to take the teeth out on a 20-something-year-old person? I don't. But it's like that house damaged in a hurricane. The floors are soaked, the carpet's soaked, the walls are soaked. They had termites before the hurricane hit. The roof's blown off. You look at that house and you go, oh my gosh, do we really want to fix it, or do we want to take 3 bulldozers at the curb and knock it down and start all over again? That's what all-on-4 is, and the longer you've been in practice, the more practical I think you'll become. Even if you could save the teeth, it's so involved, it's so expensive that it's, in that case, no matter what the age of the patient, it's more reasonable to take out the teeth and replace them with all-on-4. Thank heavens we have all-on-4. And she gave me the okay to discuss this with her parents, i.e. restoring the teeth, including the possibility of some extractions, versus extracting all the teeth and replacing them with all-on-4, including cost and time for both options. I gave them an overview of what it would cost and how long it would take if we saved all the teeth with periodontal crown lengthening surgery to get above and below the decay, to get clean, non-decayed surfaces onto which you could place the margins of the restorations and then restore all the teeth, including endodontics on the severely decayed teeth and possible extractions. I wanted this dentist to have my examination, radiographs, and diagnostic photographs so you could discuss your case and treatment possibilities with him. This has been her dentist and the family's dentist for quite some time. He referred them to me. I wanted them to talk to somebody that they knew and had confidence in. Certainly, I would encourage you and your parents to get a second opinion if you have any questions regarding my diagnosis and treatment plan. I'll cooperate with any dentist you wish to involve in your treatment. If you wish for another dentist to perform the treatment, I'll be happy to send records of that dentist. Sedation is often difficult if the patient is taking Adderall or other ADD medications. I found these patients do not sedate well. That's just a fact. I use IV sedation every morning. If a patient's taking ADD medication like Adderall, or if they're taking antidepressants, or they're taking any of those type medications, Demerol for pain, they don't sedate as well. If they're an alcoholic, they don't sedate as well as people that are pure as a driven snow and don't take medication. It just increases their tolerance of the medication. Your parents phoned my office and said they would like to try and save and restore your teeth versus extracting all the teeth and replacing them with all-on-4 fixed implant-supported prosthesis. We discussed the cost of the storing the teeth would be around this. Extracting all the teeth and replacing it with all-on-4 would be this. So I've done everything I know to do to tell this patient and her parents what I've diagnosed. Now, does that mean every dentist would do it that way? Hell no. Somebody might want to go in there and put big fillings in all those teeth. That sounds like a nightmare to me, with all that decay on the facial surfaces of the teeth, the hypocalcification that's going to be decay, the moderate to severe decay between basically every tooth in her head. Putting composite fillings on those, my experience has been that becomes a much worse situation down the road, and they're going to spend considerable money with a lot of treatment to patch it up, and at some point somebody's going to have to face it. So in my practice, I'd rather face it from the get-go, but I'm encouraging them to have anybody look at the case, anybody do the case that they've got confidence in. I'll help them all I can. They've got this down here that says received by. This doesn't mean agreed to. And once they agree and accept this, the girl's going to sign this, and I'll have the parent sign something too. Restorative treatment. So this is what they called and said they want to save the teeth. We talked about the cost. They knew what it was going to cost ahead of time. Say deep cleaning prior to periodontal surgery, fine scale and polish, oral hygiene instruction. Watch my videos on YouTube. Dr. Steve Cutbirth, The Dental Minute, how to keep your teeth for a lifetime, how to brush and floss your teeth, and tooth decay explained. And I've had the come to Jesus with this girl, and I said, you got to perk up. You've got to do your part, or nothing, and I've told the parents this too, nothing I do restoratively cannot be destroyed if you try hard enough. If you don't take care of it, if you drink Coca-Cola and you eat sticky sweets and you don't floss your teeth and you don't rinse with mouthwash and you don't use a Sonicare toothbrush, all those things, don't wear a night guard, you can tear this up. And I'm not going to be responsible for it. I can fix it. It's going to take a pound of my flesh to fix it, but you can tear it up if you don't take care of it. She said, no, I'm through doing all that. I'll take care of it. So I want to do a deep cleaning and get all the plaque and calculus and off the teeth, and give it a few weeks and let the gingival tissue have a chance to perk up and get healthy, and see if that happens. If it doesn't happen, if the gums continue to bleed and they're unhappy, we're not going on with the treatment, because I know she's not taking care of it. So first, deep cleaning with local anesthesia, and she'll be sedated for that. Then I'm going to do periodontal crown lengthening surgery to move the gingiva below the lower decay and above the upper decay, so we have clean, undecayed margins for the restorations. You can watch my videos in dentistrymasterclasses.com. I've got multiple cases that I've done this on, and I showed this to the parents, and these cases to the parents and the child, this daughter. So they've got a pretty good idea of what's going to happen. Then part two is restore all the teeth with veneers or crowns, endodontics on some teeth if needed. extraction of any severely decayed teeth or hopeless teeth. Any teeth extracted except second molars would be replaced with implants or fixed bridges. Second molars would not be replaced. IV sedation, night guard. This is the cost, and this is how they'd pay for it. So I've done everything I know to be open about this and tell them what I found and what I do in my practice. It's like any medical procedure. You may have some physician that does it a different way. This is possibly not that. Somebody could patch it up. I don't want to do that. Get somebody to do it the way you want to do it if you don't want to do it this way. And then they sign, agree to and accept it. So what I don't want is somebody coming back after this is over and say, you didn't tell us. Well, I don't know what else I could tell them. I've showed them other cases. I've talked to them on the phone twice. I've met with the girl in my office, told them get a second opinion, sent the photographs and the radiographs to her dentist back home so he could look at them, and he agreed with exactly what I was saying. I mean, this is hard. You got multiple appointments. You got healing of the gingival tissue. Plus, somebody's got to pay for it. I've got these people working in my office, these mean people, and this office overhead and these lab bills that somebody's got to pay. And all of us do some cases at a discount, or we do some people for free pro bono work, but you can't do it with the kind of practice I've got. Somebody's got to pay for it, or we go broke, and then you can't help anybody. So that's the new patient consultation, and I've done this with the patient in my office, and since her parents are in another state, I invited them to come down for the consultation, but they said, no, we'll be fine doing it over the internet. So I put those radiographs and photographs that you saw on the computer screen so they could see them. And then I put the other cases that were similar to this on the internet and went through them so everybody understands the procedure as well as I can explain it and as much as they want to understand it. That's the consultation. I call this letter my relationship letter. My granddad told me, write everything down and have people sign it, and it makes for good relationships. So I don't want to just tell them this. I want to write it and have them write it down and have them sign it and date it so that they know what we're getting into. That's how we do a consultation in a complex case like this. If it's easier, we do it basically the same way and just go over the things, always using the radiographs, the photographs, these books, the dental diagnosis and the aesthetic restorative dentistry books, so I can show them what pathology and what restoration looks like. And I've got PowerPoint cases, I've got articles I published, I show them that. And so we have a clear understanding of what their condition is and what, in my opinion, their options are. And I always encourage a patient to get a second opinion if they've got any questions about what I'm telling them. What I've found through the years is people are generally visual learners. And if they can see these photographs of what decay looks like, interproximal decay, abfraction, cracked teeth, different things, and then they see their photographs on the screen, the diagnostic photographs, they can understand it. And they can have that clear understanding of what their condition is and what their treatment options are. So in these 3 videos, we discussed the new patient interview, the new patient comprehensive exam, and the new patient consultation. In the next video, I'm going to show you a live new patient consultation in my private office. That's dentistrymasterclasses.com. These techniques work, and they work every time.